Hi guys, welcome back to the channel. After the weekend, we'll be starting the new topic, that is osteoblastoma. Okay, let's start. Osteoblastoma, clinical presentation and pathogenesis. They are benign neoplasm of bone. They are very rare tumors. In jaws and facial bone, they show local bony expansion associated with a mild, deep and dull pain. Okay, whatever lesion we have seen till date, we have seen mainly they are painless and asymptomatic, but this osteoblastoma shows expansion as well as is associated with a mild deep dull pain. Expansion is tender to palpation. Obviously अगर पेन होगा तो टेंडरनेस रहेगा. Men to women ratio is 2:1. That means men are twice more affected than women. Teens or early 20s. Mostly they are seen in teens or early 20s. Those occur in children and preteens seem to be more aggressive and recurrent. Generally they occur in teen or early 20, but if they occur in children and preteen, they are more aggressive and recurrent. Radiographically, well-defined mixed radiolucent and radio-opaque masses. So this is a mixed lesion. The rim may be radiolucent or sclerotic depending on its state of activity and maturity. तो जो lesion का rim रहेगा, that is the outline, can be radiolucent or sclerotic, which will depend on the activity and maturity, which means rapidly expanding active lesion usually have a radiolucent border, whereas quiescent or slowly expanding lesion exhibit a more sclerotic border. अगर रैपिडली एक्सपैंडिंग लीशन है, एक्टिव लीशन है, तो दे विल शो अ रेडियोलूसेंट बॉर्डर. और क्विसेंट लीशन है, मतलब क्विसेंट इज काइंड ऑफ छुपा हुआ या देर से डिस्कवर्ड हुआ. और स्लोली एक्सपैंडिंग लीशन है तो दे विल एग्जिबिट अ मोर स्क्लेरोटिक बॉर्डर. नाउ in rare instances, this tumor is not well demarcated and induce a reactivity in the surrounding bone, creating a sun ray appearance suggestive of osteosarcoma. बहुत रेयरली ऐसा होता है कि they are not well demarcated and they induce a reactivity in surrounding, which create a sun ray appearance, which is seen in osteosarcoma, not osteoblastoma, but sometimes they show this appearance. Because osteoblastomas arise from osteoblast in bone and are not odontogenic in the jaw, they can occur in other places other than alveolar bone. So they are not odontogenic and they arise from osteoblast in bone. So alveolar bone के अलावा ये और भी जगह पे होते हैं. Now coming to pathogenesis. Benign neoplastic proliferation of osteoblast, obviously they arise from osteoblast, so proliferation will be of osteoblast. The spectrum and variability of genetic alteration has generated the terms osteoid osteoma and juvenile active ossifying fibroma. So इनका जो जेनेटिक ऑल्टरेशन होता है, एज इन कौन से स्टेज पे ऑस्टियोब्लास्ट प्रोलिफरेट किए हैं, अर्ली या लेटर, उस स्टेज पे डिपेंड होके इनके दो वेरिएंट्स बताए गए हैं, दैट इज़ ऑस्टोइड ऑस्टियोमा एंड जुवेनाइल एक्टिव ऑसिफाइंग फाइब्रोमा. कहीं कहीं पे ये दूसरे जगह दे हैव बीन डिस्क्राइब एज अदर, पूरा लाइक अ लीशन और अदर पैथोलॉजी, बट they are the variants of osteoblastoma, osteoid osteoma and juvenile active ossifying fibroma. Now, if they are less than 2 cm in size and have a sclerotic rather than a lucent border and produce pain that is responsible to the anti-inflammatory action of salicylate, they are considered as osteoid osteoma. तो अगर osteoblastoma जो 2 सेंटीमीटर से लेस साइज़ के हैं और स्क्लेरोटिक बॉर्डर है एंड दे प्रोड्यूस पेन एंड दे रिस्पॉन्स टू एंटी इन्फ्लामेटरी एक्शन ऑफ सैलिसिलेट, दे आर कंसिडर्ड एट ऑस्टोइड ऑस्टियोमा which are less than 2 cm and have a sclerotic border. and responsive to anti-inflammatory action of salicylate are considered osteoid osteoma. Okay, that's all for today. We'll be continuing this in the next class. Till then, like, share, subscribe and comment. Bye.